Okay? Chapter 17, if you haven't realized, is the big chapter. You know, that we spend a lot of time on nursing process. Okay? So we're not going to spend near as much time on the other sections, but they're still important. Okay? And so if you move to page 7 of my handout, if you guys are big on acronyms, if you remember ADPI to remember nursing process, okay, assessment, diagnosis, planning, intervention, evaluation, okay, that's another way to remember nursing process. It is cyclical. What do I mean by cyclical? Yeah, I mean, I could go in the morning and, you know, students will tell me we make you sometimes do a prep or come up with a potential plan of care, and you go, okay, this is what I'm going to do today. I get in that room, and this patient has a saturation of 80%. Guess what? My priorities just changed. And they can't breathe laying flat. Guess what? My assessment focus changes. My plan of care changes. I change my interventions and my prioritization to what's going on with that patient right then and right there. Okay? And so I am constantly assessing, coming up with problem lists, planning out my day, and completing interventions. Anything that I do is an intervention, and then I'm evaluating that intervention. And guess what I'm doing again? After I evaluate an intervention, I'm assessing again, okay? So it's not like this ever stops with us. And so getting this whole thing in your head and recognizing that when we test you, when you study, when you do all these things, if you're studying based off nursing process, especially PCC, going, okay, what am I going to assess for? What problems can arise with this patient? Do you see how maybe that could help you with studying as well? What types of interventions do I need to do? A lot of your textbooks are laid out in the nursing process format, okay? And when we test you in the types of questions, sometimes if they're priority questions, it may be a question of you've intervened, or you've inserted this Foley catheter. What is the next step? You know, and a lot of that has to do with nursing process. Okay, so it's a revolving process, and as the patient's conditions worsen, changes, it's going to continue to change. And those of us in here that have been nurses a while, Kat, Joe, Nancy, we can attest that this changes all the time, right? It's not a process that you're ever going to get to go in one ear and out the other. Okay, so I do want to talk for a minute about chapter 18. Talked about the plan piece. Okay, and the planning piece is where we come up with outcomes or goals for our patients. Do you guys have a goal for school? What's your goal in 2 years, a little less than 2 years from now? What's your goal? Graduating. So how do you know? What are the things you have to do, or how are you going to know that you get to graduate? What? Get a 78 on my exams.
Minimum.
Do you really want to have a 78 all the way across? Right? Attend what else? What are some of the other things that you've set up for you that's going to determine that you graduate in 2 years? Huh? What? Get being in clinical for the amount of hours that Stacy and the rest of us say I have to be in clinical, right? Participating, meeting the expectations or objectives for each course. So when I'm telling you this, and I talk about writing common expected outcomes or setting patient-centered goals, do you have a student-centered goal in mind for yourself? Yeah? And you know what you have to do to accomplish that? Is it measurable? Is it specific, measurable, attainable, realistic, and timed? Do you know what I mean by that? What's specific? What do you think?
Like only one goal.
Huh?
Like a one specific.
Or it's specific, right? You know what you have to do, right? Okay, it's specific. In order for me to graduate, okay, it is specific. So when we write goals, one of the things, and you guys, I'm not going to lie, those of us that have been nurses for a long time, even when we get up into graduate school and we learn how to write learning objectives, we are taught to try to write them in a specific, measurable way. Okay? And so for you, if you tell me, okay, the patient is going to eat an adequate amount of their meal, what am I going to ask you?
What's adequate?
What's adequate mean? You know? Okay, so when we set these goals, they have to be patient-centered. Have you heard the word patient-centered before? Yeah? How many times have you heard that word?
Too many.
Too many times. Ad nauseum, right? You've heard it. So it must be important. Okay? So it has to reflect the highest possible level of wellness and independence in the function of the patient. It must be realistic based on needs, abilities, and resources, and patient-centered is a reflection of a patient-specific behavior. When we develop a plan of care for a patient, do we include them in that development of a plan of care? Yeah, it's not something I write and say, here you go, Tristan, this is what you're going to do today. It's going to be, okay, Tristan, let's talk about what the plan for today is and what what you need to be doing and I need to be doing to get you better and get you out of here. Okay, so it's patient-centered. Remember, it's not what the nurse is going to do; it's what the patient does. So when we're writing this, it's patient-focused. So when we write a goals, you need to remember this acronym. Is it specific? Is it measurable? So is it attainable, realistic, and timed? And I've given you examples. Specific addresses one behavior. Patient's lungs are clear to auscultation. Okay? Measurable, must be able to measure or observe the behavior. So an example of this would be patient's pain. If you say patient's pain is tolerable, I'm going to give it back to you and say, what does tolerable mean? What do I want to see here? A number. You guys are learning. Assessments, right? Blood pressure readings, right? What's a normal pulse ox? Are you learning this stuff? What's normal pulse rates? What is normal breath sounds? What is, abnormal, this, that, and the other thing? Those need to be specific. What do I want to see this patient's range of pulse rate if I'm saying that their pulse rate's going to be normal? That's what makes it measurable. Attainable. What about attainable? Okay. Is okay. Attainable and realistic in a way somewhat come together. Attainable is for health to improve, the patient has to be able to obtain the outcomes of care that are set. Okay. If this patient was in a motor vehicle accident and have pelvic fractures and things like that, are they going to be able to attain a goal of walking around the nurse's station 5 times by the end of the first post-op day?
I sure hope not.
I hope not, okay? You know what I mean? Or is that realistic as well for them, right? And when we talk about realistic, like for patients that are stroke patients, if you were to write a goal that said this patient's going to obtain 100% of full function, they're paralyzed on the left side, and you write a goal saying they're going to get 100% of that function back. Is that realistic for that patient? So do you see where I'm going with this stuff? Okay, when you're writing these goals. The nice thing is that this book helps you to write these goals in this way and get used to writing these goals, okay? So realistic, and then timed. Timed means, like, when do you want this to occur? Is it 2 days, 3 days during this shift? Do you want to make sure breath sounds stay clear during each of your assessments? So we have to have that time frame on there, okay? So, again, me giving you specifics on these notes, if it's here, guess what? That's the stuff that needs to be engraved up here. I need to write these goals in that specific, measurable, attainable, realistic fashion. Okay, so I want you to look in your books on page 445 or whichever one I have. I'm still under the chronic obstructive pulmonary disease. Find where it says common expected outcome. This is a goal or an outcome. Okay, so if I look at page 445, it says patient will maintain clear open airway as evidenced by normal breath sounds, normal rate, depth of respirations, and ability to cough up secretions. And I might add a time on there during each shift assessment or by the end of the shift or prior to discharge, okay? Is that goal specific, attainable, realistic? The one that you're looking at? Has everybody found one to look at? Just find something that says common expected outcome, and that's what we're looking at here, okay? You have a text that's going to help you write these things if you don't know yet, and we don't expect you to know it right at this point, okay? Okay, so that gives you an example of that. When I flip over to the next page, then we're going to look at developing interventions, because this is part of the planning phase of the nursing process. And you're going to see, if you look at page 445 or whatever page you want to look at, after you see the common expected outcomes, you're going to see where it has NIC interventions or ongoing different interventions, actions and interventions and rationales listed. Okay? So when we develop interventions, we have to look at the different types of interventions that we develop, and interventions are what we do, or what we collaborate with someone, a physician, physical therapy. An assessment can be an intervention, especially if it's written into the care plan that I need to assess this vital signs every 4 hours or what have you. Okay, so when you break it down in your book, it talks about, we have independent nursing interventions, the nurse initiates it, so like positioning a patient to prevent pressure ulcers would be something I don't need an order to do, okay? So instructing the patients on the side effects of medication, there are going to be interventions that we cannot do unless we have an order from a physician to do it, okay? And so that's a question, like putting in a catheter, can I do that without an order? But is that an intervention? Yes. Can I assess the catheter? Do I have to, that's not necessarily, I don't have to have an order, that's a standard. We'll talk about standards and policies to assess that catheter to ensure that it's patent and that the urine is flowing. Then we have dependent nursing interventions, which require an order from a healthcare provider, like inserting a catheter, administering an IV or intravenous medication. And then collaborative. So collaborative would be like, I'm finding that my patient has a pressure ulcer, and a lot of hospitals have standards where if we see that, we can call WAC, wound ostomy continence, and ask them to come, or collaborate with respiratory therapists on administering respiratory treatments, or collaborate with physical therapy on transferring with mobility. So do you guys see these interventions? Okay. All right, so when you look in your pages, you're going to see, because we don't expect you to know this stuff yet and everything that you have to do, you're going to see interventions that are listed, okay, and things that we're going to do. And we're going to be working and putting a nursing process together in just a minute, where we're going to be listing some of these nursing interventions for specific diagnoses, okay? So that's when we get into the planning phase, and then we get into the implementation phase, which was chapter 19 of your Potter and Perry book. And with that, we have direct care interventions that are treatments performed through interactions with patients, and then indirect interventions, which are performed away from the patient but on behalf of the patient, such as documentation,